As I mentioned before, you will likely be involved in some type of performance improvement project at some point during your career. Is to provide a general overview of quality and performance improvement as it applies to healthcare organizations. You will be introduced to a generic performance improvement model, as we will define some of the commonly used performance improvement terms, and explain the philosophy of continuous performance improvement. We will also discuss current techniques and methodologies used in healthcare today. By the end of this module, you should be able to do everything listed on this slide. Efforts to provide quality healthcare services in the United States have been in place for over 30 years. Over the years, these efforts have been known by different names. Take a look at this slide. These are some of the names that have been used to describe various quality and performance improvement models. There has been some varying degree of success with these models, and there have been thousands of books and articles dedicated to this subject. Accreditation organizations, such as the Joint Commission and licensing agencies, have the expectation that healthcare facilities will strive for the highest possible quality of care at all times. Experts in the field are oftentimes employed by the facilities and are responsible for organizing the PI activities and reporting the results to the leadership and board of directors. Keep in mind, all employees of the organization are expected to have a general understanding of the performance improvement principles and are required to participate in the PI activities. This slide depicts the hospital or healthcare facility's organization-wide process. As you can see, it is an ongoing cyclical process. Organizations identify the performance measures. Next, the performance is measured. Step 3 is to analyze and compare internal and external data. Improvement opportunities are identified and perform ongoing monitoring. Once the cycle is completed, the process starts again. On the last slide, you saw that the ongoing performance monitoring process looks like at the organization-wide level. This slide shows you what happens at the performance improvement team level within the organization working on a specific project. The team identifies an improvement opportunity. This can be an issue that is happening at the departmental level and not at the hospital-wide level. Once the team knows what issue they want to improve, they will define what the performance expectations should be, and the team will either design a new process or redesign an existing process. Next, the new or redesigned process must be implemented. In some cases, a new process may not be required, but rather the employees may simply need to be provided with some education related to the expectations on how things are done now. It is important to document and communicate the findings. If adjustments are needed, the performance expectations may have to be redefined and the process continues. This slide may look a little confusing, but actually this slide just shows that both processes are happening at the same time within the hospital or healthcare organization. The overall organization-wide performance improvement process is depicted with the black arrows, while the team-based process is happening at the same time. Together, the cycles make up the healthcare performance model. Of course, the healthcare organization must prioritize what processes they are going to work on. No organization is perfect, and as I mentioned, quality improvement is ongoing and continuous. But it's very unrealistic to work on all issues at the same time. The organization must identify which processes or issues that need to be improved and prioritize which one they are going to focus on. It would be logical to start with those areas that perform important organization functions. Generally, organizations will start by looking at those areas that are high risk, high volume, or problem prone. High risk areas are those functions that place the patient at risk for poor outcomes. A high volume are those functions that impact a large number of patients. And problem prone are those areas that historically have caused repeated problems. Customer feedback and requirements of regulatory agencies should also be considered when prioritizing your performance monitors. Once you have determined what you are going to monitor, it is important to determine what data will be collected for each performance measure. Just as the name suggests, you must be able to measure your performance. The best way to do this is to use a rate, a ratio, an index, or a percentage. For example, you may strive for 95% accuracy in coding. If you find that your coders are falling below the acceptable rate, an opportunity for improvement has been identified and a team-based PI process may be initiated. It is important to establish a benchmark for a particular process or outcome. Benchmarks are established by either comparing your performance with your organization's historical data or comparing your data to similar organizations. The benchmark is also known as a standard of performance or a best practice. In this case, the benchmark was set at 95%. Once the benchmark has been determined for each performance measure, analyzing the data becomes more meaningful because you know how you are doing. Let's take a look at another example. In this case, we are going to monitor the number of incomplete records that exceed the established time for chart completion. The Joint Commission has an established standard for delinquent records and will cite the healthcare organization with a requirement for improvement if the total average healthcare record delinquency rate exceeds 50% of the average monthly discharges in any one quarter. Hospitals commonly set their benchmark for health record delinquency rate below 50% because they don't want to cut it too closely. So you might be asking yourself, what does that mean? Let's say that the hospital has 1,500 incomplete records, and our medical staff established a time frame saying that the incomplete records must be completed within 28 days of the patient being discharged. So of our 1,500 incomplete records, 650 of them exceed the time frame set by the medical staff, meaning that they are still incomplete 28 days after the patient was discharged. The 650 records are considered to be delinquent. We would not count the incomplete records for those patients who were discharged less than 28 days ago because they are still within the time frame set by the medical staff and are not yet considered delinquent. We also have to know how many patients, on average, our hospital discharges every month. In this example, our hospital, on average, discharged 1,200 patients each month. So to meet the Joint Commission standard, we cannot exceed 50% delinquency rate. As I mentioned earlier, hospitals will oftentimes set their benchmark a little lower because they do not want to push the absolute limit of the Joint Commission. So our hospital set our benchmark at 45%. So for our example, for our performance measure, we would divide the number of our delinquent records by the average number of monthly discharges to see how we are doing. Our rate is 52.2%, which exceeds the Joint Commission standard of 50%. It also exceeds the hospital's benchmark of 45%. This is not good. We have too many delinquent records this month. Remember, the Joint Commission looks at each quarter of the year, not each month. So within a 3-month time frame, we have to be below the 50% for Joint Commission. If our performance continues at this rate, the Joint Commission would cite our hospital and require a plan for our performance to improve. In this example, we are looking at employee turnover rate for Community Hospital of the West. A low employee turnover rate would indicate that employees are staying longer and not being replaced with new employees. It is very expensive for an organization to hire and train quality employees. If employees are not staying, not only is it costly to replace them, but it may also indicate other underlying issues such as low employee satisfaction for a variety of reasons. It's very important to track this data. This chart displays 4 years' worth of data. Each year, the employee turnover rate is reported each quarter. The performance measure is the employee turnover rate. So look at the bottom, we have year 1, 2, 3, and 4. Within each year, we have reported for each quarter of the year. It was determined that a 6.5% turnover rate was standard, and this was set as the external benchmark. However, after comparing data from other hospitals in the community and state, it was determined that a 5% turnover rate was considered to be the best practice for our area. The internal benchmark was set at less than 5% because the Community Hospital of the West wanted their employee turnover rate to be lower than other employers in our area. The data was plotted on the chart over time. This allowed the hospital's administration to see if they were beating the benchmark set, and they could also see trends in the data. In this example, it was obvious that the turnover rate was steadily climbing during the third year, and by the end of that year had reached an over 6% turnover rate. The hospital was not meeting their goal during the second half of year 3, but the fourth year was much better. When the turnover rate started to climb, the Performance Improvement and Safety Council recommended that further data analysis was necessary. At that time, it was discovered that most of the employees leaving during the third year were nurses. The employees completed an exit survey when they left. Those surveys were reviewed, and it was determined that the nurses were leaving because of salary and benefits. The nurses were taking jobs in other area hospitals that offered higher wages and benefits. This was evaluated, and a more attractive salary and benefits package was offered and advertised. Keep in mind, an increased turnover rate won't always be related to pay. Other factors can play a part in why employees leave. It is the performance improvement team's job to find out why a performance measure is not being met. This slide shows how our performance improvement model was used to address the issue. Remember, the organization-wide process is displayed with the larger black arrows, and the gray arrows show what was done at the performance improvement team level. After the performance improvement team has researched and defined the performance expectations, they would want to evaluate the current process. Some of the possible first steps are included on this slide. If the team determined that improvements are needed to the current process, they may recommend redesigning how the process is done. The steps involved are outlined on this slide. Performance improvement teams use a variety of tools to accomplish their goals. Over the next several weeks, we will discuss some of the tools that are commonly used in the performance improvement process. Tools make it easier to collect, analyze, and display your data. Six Sigma is a philosophy that many healthcare organizations apply to their performance improvement programs. It is widely used in businesses outside of healthcare as well. Six Sigma uses statistics for measuring variations in a process. The intent is to minimize errors by minimizing variations in a process. Sigma refers to the standard deviation used in descriptive statistics. It is important to know that Six Sigma means that there will be no more than a 3.4 errors per 1 million encounters. Hospitals employ those who are certified as Six Sigma experts. It is important that the Six Sigma expert understands the complexity of healthcare. With Six Sigma, you are to have few standard deviations from your average. The goal is to reduce variation in your process. For this example, let's say that it was critical that your customer receives a product within 9 days of placing their order. This chart compares the delivery time for your service. The black line shows the delivery time for all of your customers before the improvements were made. Your customers received their product anywhere from 2 to 12 days from the time they placed their order, with the average being 7 days. Though you would have a few very happy customers because they received their product very quickly, you would also have several unhappy customers because you missed their critical 9-day deadline. After the process was tightened up and you had less variation from the average, the process improved. Take a look at the lighter line. The average delivery time is still 7 days. However, instead of the delivery time varying anywhere from 2 to 12 days, which is 5 days before or after the 7-day average, the customer received the product between 4 and 10 days of placing their order, which is only 3 days before or after the average delivery time. We will go over calculating the standard deviation in a later module. As you can see, while the base of your curve became smaller, the height of it became taller. This is because there was less variation in the delivery time, and the frequency of it happening within that narrower time frame increased. Even though your average delivery time stayed the same at 7 days, you had fewer customers receiving their product after the critical 9-day deadline, which should result in fewer complaints. Future performance improvement opportunities may include decreasing the average delivery time to, let's say, 5 or 6 days instead of a 7-day average, while continuing to have very little variation from the average, or possibly tightening up the average delivery window even tighter. Lean is the name of a quality improvement technique. It is widely used in the manufacturing industry and has been adopted in many healthcare organizations as a way for them to streamline their processes. Just as the name implies, it cuts out all that is unnecessary. The organization is to work in an efficient or lean manner. This slide lists how some of the processes can be streamlined and how lean can be adopted to healthcare. Being patient-centered, reducing waste, and getting to the root cause of a problem is key. We will talk more about root cause analysis in a later module. With systems thinking, it is important to look at the organization as a whole. All of the departments within the hospital are interrelated, and most work together instead of independently of each other. For example, if the patient's information is entered incorrectly into the system during the registration process, it can cause issues outside of the registration department. If not done correctly, a duplicate record may be created, resulting in diagnostic and other reports being sent to the wrong chart, and the physician will not receive all of the information needed to properly treat the patient. Or a test may be ordered unnecessarily for a second time, putting the patient at risk and wasting money and other resources. Entering inaccurate or incomplete data may cause problems for those coding the record or billing for services. Having inaccurate data in the system can impact anyone who uses it to perform their job. Almost everything is a system. For example, the human body is a complicated system with several subsystems. Getting ready for school or work in the morning, a healthcare organization, and each department within the healthcare organizations are all systems. Each system has inputs, processes, and outputs, and many systems have subsystems within them. Within the Health Information Management Department, the coding function would be considered a subsystem. Its input would be the patient ID that was the output from the patient registration department. They collect data, review chart for documentation, etc. The process, entering diagnosis and procedures into the encoder and grouper and apply the appropriate guidelines and sequencing rules. You'd have to enter the physician's ID numbers for each surgery that was performed and the procedure dates. And you would enter the appropriate disposition codes. The coder's output would be the principal diagnosis codes, the secondary diagnosis codes, procedure codes, etc. This becomes the input for the billing department. With systems thinking, individuals think as a whole, how their job impacts others. Think of what could go wrong during the registration or coding or billing process. Slow, inefficient methods can have an impact in several areas, such as delayed billing, which can result in cash flow problems for the hospital. Incorrect demographic information may impact DRG assignment and reimbursement or other issues. System analysis tools can be used at the team, organization, and environmental levels. There are 4 groups of analysis tools. The type of tool used will depend upon what is being studied. For example, modeling and simulation tools work well when analyzing wait times, such as the emergency department. Enterprise management tools are used when dealing with the complexity of business in healthcare, such as suppliers and distributors. Financial engineering and risk management tools may be used when predicting the risk of financial losses. And knowledge discovery tools are used to retrieve different types of information, for example, data mining or classification. The methodology of high reliability organizations, or HROs, were originally in those organizations with a high risk of error or failure, and the impact of an error could be catastrophic, such as in a nuclear power plant. Because healthcare is an industry with high potential for error, with a significant negative impact should an error occur, many organizations are seeing the benefit of implementing the HRO methodology. High reliability organizations have learned to manage the unexpected. These organizations try to prevent unexpected change or at least anticipate or prepare for it. HROs have learned that most errors occur because employees are either not focusing on their job or they are distracted. This usually happens when the employees are hurried or overloaded. HROs are focused on mindfulness with a heightened awareness of the task they are performing and sensitivity to possible failure. Employees are to discover and correct any errors before they escalate into larger problems. Employees are also empowered to speak up should they identify a problem or a distraction.